So I'm going to invite our final panelists up, and these are all the moderators from the sessions starting early on. Dr. Cody, Dr. Shaw, Dr. Kim, Dr. Rakoff, Dr. Singh, and Dr. Hu, if you can have your cameras on, and we'll start. And then I want to thank all the attendees who have stuck with us for the whole day. Thank you for all of your wonderful questions. And I would love for our panelists if you might be able to use the Q&A function in this last session to just tell us where you're dialing in from and where you are. We were so impressed with some of our speakers recently who were giving talks at 4 in the morning in Japan and at 1 in the morning in India. So thank you all. We are really grateful for this international presence, and we have really learned so much. So I have the great honor of moderating this final session of my esteemed colleagues. And I am going to start by asking each of you in the order of the panels, what were the key takeaways? I think we were impressed in every session to have representation from almost every continent. And it was really a unique opportunity. And I'll start with Dr. Cody. As mentioned by many speakers, we are grateful locally for you having taken us so ably and leading us through the pandemic and keeping each of us and our families safe locally. So thank you. I will add my thanks and ask you key takeaways from your session on public health. Dr. Cody.
Thank you so much. It's wonderful to rejoin. I'm at the Emergency Operations Center in Santa Clara County, in the same time zone. And I wish that I missed so much of the rich discussion all day. I regret that I wasn't able to stay on, but I caught the end of the last panel, which was fantastic. So just to recap a little bit about the first panel we had today on public health, I think what struck me was the commonality. You know, our panelists were calling in from time zones around the world and describing some of the challenges of addressing the pandemic in different countries. And I was actually really struck by our speaker from Rwanda. I think that it all begins with trust. It all begins with trust. And the way that the response has gone in various places, this has so much to do with governance and trust in governance. That seems to be making so much so much of a difference. And you know, I think we see that in different communities across the United States as well. But the key themes to me were just the theme of our ability or lack thereof to understand what's happening, to gather our situational awareness, whether it's by ramping up lab testing or not being able to ramp up lab testing, or get the results together or not get the results together. And then our community's understanding of what to do with it. And the science has evolved. I can't believe that we were all furiously cleaning things a year ago, but we were. So we learned a little bit about, talked a little bit about the science and then what we should do given what we know. But I think the real key is how to marry human behavior and how we behave along with how the virus behaves. And I think that we still have so much to understand about how we behave, and we still have a bit more to understand about how the virus behaves. But at the end of the day, the ability of a community to protect itself, I think, really comes down to trust, and the community's trust in the leaders and the spokespeople. Are they honest? Do we believe what they're saying? Do we have the resources to do what people are asking us to do? And I was just also reflecting here in the United States, of course, I don't think we provided people with the resources that they needed to be in sheltering at home for long periods. We were not effective at mobilizing resources to replace people's income in the way that it sounds like this was actually a bit more successful in Rwanda. So I just, it was really lovely to hear a bit of a global perspective and see the commonalities that have thread through. And together we'll have to be, in order to be ready for the next pandemic, we spoke a little bit about the need for action and being interconnected and recognizing the global community of which we're all a member.
Thank you, Dr. Cody, for those insightful comments and for really bringing your contextual awareness on a local level and being able to generalize lessons on a global level. So thank you so much. And next, we'll move to Dr. Nickim Shaw on the data session, if you don't mind sharing some key takeaways, Dr. Shaw.
Thank you. There's a few categories of takeaways, and I'm going to give one or two in each. The first one is local. I was kind of shocked at the complete absence of the data infrastructure for the kinds of things we needed to do. I remember sort of in mid-March, we were emailing screenshots and plots to Sarah Cody's office in the hopes of providing some useful information, otherwise in an office that was trying to do the right thing and flying blind in absence of data. On the positive side, we did come together. And after a chaotic period of having to report hospitalization in 6 smart sheets, we did consolidate, and we do now have one number being reported, and it usually matches up between the county and the state, but plus or minus 5%. So the absence of infrastructure and the complete sort of lack of thinking of data as a strategic asset was a shock. And I think it was a shock in many countries. I mean, there were a few countries that did get it right. Like I speak with one of our colleagues, Jason Wang, and he tells me stories about Taiwan. And I was like, Jason, just don't tell me that. It just makes me sad. You know people who landed and where they went and what their medical record is. Like, seriously, like, how is that possible? So that's on the data infrastructure. Then, so the second category is that a lot of people just jumped in saying they could read Wikipedia and figure out epidemiology in like 30 minutes. And I was like, guys, there's a discipline, it takes about a decade or maybe 5 years, 6 years. And so there was a lot of chaos in that space. A lot of computer scientists rediscovered a lot of things that were kind of, 30, 40 years old, invented, and people kind of knew what works and what doesn't. That also died down, and eventually the collaboration started. People from Google, Apple, a lot of technology companies started talking to public health officials, partly based on friendships, partly based on trust, a lot of chaos, but in the end, the system did settle down into some rhythm that was useful. And sort of the third was, so we talked about infrastructure, we talked about skill set and people trying to help. And the third was, and this was like for me and for the panelists that were there, public health and the way tech works, the fundamental axes of organization are so different. Like we could be from Mars and Venus, and that would still be pretty close actually. There's 3,000 or so counties and whatever many offices, and they all have to do their own jurisdiction, and the local school district has to listen to them. And even if there's a new data source, they can't by law listen. It's a disaster. On the plus side, we're having a national conversation about having an Office of Pandemic Response. In the latest bill that passed, there's like $500 million allocated towards setting up that national center for pandemic response. So it's kind of schizophrenic in the sense that initial shock, chaos, people coming together, and in the end, the imperative to do the right thing, allowing people to overcome, egos and a lot of other incentive issues and so on, and eventually pulling through. So that's sort of the gestalt in many countries. Israel and Taiwan and a lot of the Scandinavian countries, I think, kind of give us a goalpost for us in the US that is what we should aspire to. Sweden knows with a 7-minute delay how many people are in the ICU. We can't figure that out after 48 hours. I mean, that's a problem. So those are what we said, the big lessons: data infrastructure, collaboration across multiple disciplines, and then translating that into structural solutions that we can then not repeat the same chaos again next time around.
Thank you, Dr. Shaw. And I'll just speak to your first key takeaway, the data infrastructure. And I think investing in that in the United States is something that would benefit many diseases, not only infectious diseases or pandemics of the future, but something that we can learn. I often say that knowledge is not only an export from Stanford, it's an import. And we heard from Dr. Cody that providing support in Rwanda during the pandemic for households in terms of food was something that we could learn from here in the US. And then in terms of data infrastructure, Dr. Shaw told us about different countries in different continents that actually have better data infrastructure than we do, that we would benefit from going forward. And next I'm going to ask Dr. Kim to take the stage, who moderated the clinical care session. So Dr. Kim, key takeaways?
Thank you. To answer your earlier question, I'm calling in from Kuala Lumpur, and I've been here through the whole symposium, which has been fantastic. So first, a shout out to Latha and Bryant and everyone who helped organize this, and to all the speakers and moderators. I've learned a lot. The big key takeaway for me for my session is that local is really a microcosm of the global, and global is pretty much just a conglomeration of many local spots. And the interesting thing about the pandemic is that as the contagion spread around the world, it was actually at different stages in various regions. So this gave an opportunity, really, that maybe we could have capitalized it more, where there was experience and knowledge in some regions that could be shared in other regions that were just developing or experiencing a resurgence. In this way, the global experience then could be applied locally, and as Dr. Strelo said, tweaked to be more locally and culturally acceptable and perhaps more effective. So the fact that global could help local and local could inform global just shows, again, the interconnection. More specifically, we learned that 17 months on the treatment of, we learned a lot about COVID, and what we know continually was being updated and evolving, so that it was really essential for people to keep up to date and share information, making collaboration and communication all the more important. And collaboration meant not just with people in your own hospital and within your own discipline, but across disciplines, outside of medicine, in public health, in policy. It extended not only in the hospital and divisions, but also locally, statewide, internationally, and globally. It's really shown how, in order for us to win, we need to work together. And I guess this is another example of, in every crisis, as an opportunity to learn something and to be stronger the next time. Education was also highlighted, not only in Dr. Strelo's wonderful talk, but also for us individually as clinicians and as colleagues. And also beyond that, the importance of education of the public and the media. And again, another reminder that we need to control help, not control, work with and help and learn from media to be better informed and to inform better, to use better communication techniques. In the same way, we can use technology to leverage our education. And yet that was a double sword, I thought, because it can also, just as technology in online education and schooling is usful, it also can widen the divide for those who don't have access to it, which is actually very sad. Just like all the online appointments, all the telehealth consultations. Think of the homeless. What do they do? What do people do who don't have a computer? Or what if you have no private place to talk about your rash or your itch or other parts of the body that you don't want grandma to know about? So it's really quite a bit more, there are more problems that need to be worked out. That's not to say that having these problems is bad, because as I said, a crisis is often an opportunity to learn and innovate and to be creative. We also learned that, and this stresses what others have said, that social distancing isn't the same as scientific isolation. And I have been locked down in Malaysia now for 3 months. I was isolated outside my home in Hong Kong for 9 months. And I can tell you, part of the time I was in quarantine, and it is a miserable experience. So for people who are isolated in an even more strict way, could easily take a serious toll. And it really gives you reason to pause and be grateful. I'm grateful to have a job. I'm grateful to have a home. I'm grateful to have wonderful colleagues. And I'm grateful to be useful. So that kind of opportunity to reflect and to kind of just stop and say, well, this is what we can learn, and this is what we should help our patients and clinical care and provide in our clinical care, I think is something that I took home from all of this.
Thank you, Dr. Kim. When you said the local is a microcosm of the global, it reminded me of what we're taught in biology, that ontogeny recapitulates phylogeny. And I think we heard a lot of that today. So thank you for that insight. So next, I would like to turn it over to Dr. Rakoff, who moderated the health disparity section for key takeaways. Dr. Rakoff.
Yeah, thank you. So admit, seeing all the statistics, the data on the health inequalities, the disparities in COVID can be very overwhelming. I think we all agree on that. But this session was really hopeful, and I think people saw the opportunities that are there and what we've learned going forward. I think everyone agreed on the panel that the attention to the COVID deaths because of the data that we have and the social justice movements in the US and elsewhere have really given us a unique moment to think about health disparities going forward and take them more seriously. Affected communities have always been aware of these, but there's more people in communities that were unaffected who've become aware and are not satisfied with the status quo anymore. And so people are very hopeful, but I think there's still concern, given the sort of the attention span and how much other things change and come up, that if we don't really act seriously, within sort of 6 months to a year, that we're going to lose the opportunity and the attention we have on disparities and especially structural factors leading to disparities. So we talked about kind of two types of actions that had occurred for disparities, and underlying both was, exactly what Dr. Cody had emphasized from her session was trust. So both in the successful short-term actions. So we heard from some engagement from, it was Dr. Fortuna up at UCSF, working with folks in the mission, folks who are homeless, that they'd had the most success there, in preventing COVID and then in vaccination. in working with populations that they've been engaged with on health issues for a long period of time. So in the communities and associations where they built trust over a longer period of time. Dr. Bora had talked about back in Connecticut, some of the communities there, the indigenous communities that have been subjected to hundreds of years of trauma, just the lack of trust that was there and overcoming that. But what I found, so trust was really fundamental, both for the short-term things, but then also in thinking about going forward and, how we set this up next time. It's hard to build trust, within a few months. It needs to be a long-term process, so we can't lose sight of that. And what was really hopeful to me is, despite communities and some of these examples where there's been hundreds of years of structural racism or of trauma, that that wasn't insurmountable, and that they found, with taking the time, with listening, with being there, with acting with empathy, that they really made progress and that they saw action and that they could build trust. And so to me, there were some nice success stories of that working when they start to put in the work of connecting with communities to reduce disparity. So it was a great session, and was really grateful for all the speakers for sharing.
Thank you, Dr. Rakoff, and thank you for re-emphasizing this concept of trust. And this is an important opportunity for us, as for those of us in research as well as clinical care, that this is a lesson learned in COVID, and one that we should embark on now, is to continue building trust and start building trust now where there hasn't been trust, so that we can be better prepared to address any health crisis in the future. So thank you, Dr. Rakoff. So with that, I'll move to Dr. Singh, who moderated the vaccine session. Very exciting session on this evolving science, and Dr. Singh herself has been involved in so many vaccine trials at Stanford, and been responsible for bringing many of these vaccines to market. So Dr. Singh, your thoughts on the key takeaways?
Yeah, thank you so much. I thought it was a great session. I learned from every speaker, and I think my takeaways from this for everybody listening is that we really do want to applaud, how fast science worked safely and rapidly to get us multiple safe vaccines. And I think that has been, for me at least personally, and I think for the speakers, highlight of the year. But then there were the buts, or the asterisks, right? But this has to be a resource for the world, because as we're seeing, there isn't going to be a wall or a way to block any other country. And then until we're all safe, across the world, or at least until people have access to this, we're not going to be safe. So I think there was certainly, lessons learned from that experience. And I think Dr. Hu and Dr. Misra also talked about the fact that although science has sort of got us to this point, and this is hopefully a template for the future and for future outbreaks, that there's still a lot to learn. And I think this is where, there's going to be lots to learn about variants and boosting and immunosuppressed patients. And so really, this is the beginning of the next stage of science. And I think we want to keep our communities engaged in the ongoing learning, because I do think one of the things that's been tough about this last year is that there's new information coming out all the time. And it's hard for us to keep up, but it's really hard for the community to keep up. So how do we keep messaging, a simple message? Those who want to go deeper can, but understand, say, this is stage one, this is helping us here, and that there may be, science that moves forward. And I think the last point is that, it's now going to be all of our jobs in all of our roles, whether we're physicians, family members, neighbors, healthcare providers, community outreach, to encourage vaccination and get wherever we live, sort of those who have not been interested in or have not been considering it, to really encourage them to take it on for themselves as well as for their families. And I guess the last comment I would make is, one of the comments that Dr. Hu made, that there is a silver lining to the rapid deployment of vaccines as well as new therapeutics and monoclonals and remdesivir this year is that a lot of people have become very engaged in sort of the scientific process, and people in the community are reading about this and hearing about EUAs and clinical trials and phase 3. And so I think we have to keep engaging the community. Before this, I don't think people knew how drugs came to market. They just took their metformin or they just took their cancer medication, and did they really understand? So I think that for this, as well as for public health, like we've got to have that elevator speech. We've got to have that ongoing engagement, because that's the only way in which we're going to engage a broader community, because that's really what it takes, right? We can develop all the therapeutics we want in our benches, in our labs, but until somebody's willing to take them as a part of a clinical trial, or encourage their family member to take it, it's going to be hard. So I felt it was a very positive session, but with the caveats that there's still a lot to do around the world. But we have the resources collectively, I think, to do it.
Thank you, Dr. Singh. And if I may encapsulate your wonderful remarks into one word, it would be to celebrate, because it is really, and to quote Dr. Shaw in the chat, this is a miracle that we have gotten a vaccine this fast, that it is this efficacious and this safe. And
multiple vaccines.
Multiple vaccines, sorry, yes, multiple vaccines with multiple different biologic mechanisms, which had we previously not been aware of even, and had been proposed for cancer, and then pivoted and been able to address this infectious disease. So it's really remarkable. And also, to quote Dr. Shaw, this is the equivalent of landing a man on the moon in 1969, and hopefully it will inspire the next generation to go into medicine and science, because there's never been a more exciting time to celebrate, and hopefully in retrospect we'll be able to appreciate that.
Yeah.
So finally, I would like to turn it over to Dr. Hu to give us key takeaways from the mental health session.
Thank you so much. I'd like to start by answering one of the unanswered questions, which I think does sum up some of it, which is COVID-19 is not over. Do you think the number of mental health patients will jump in months to come? And I would say I definitely think so. We know that of the people with COVID, 1/3 will develop psychiatric or neurological issues within 6 months. That's in Lancet Psychiatry. Of the people who didn't get COVID but have been living through this pandemic, a post-traumatic stress disorder-like syndrome is developing, what appears to be an acquired phobia that we've all sort of learned to have, that it will take some time to unlearn a phobia. The effects on younger people who, during a key point in their socialization, have all of that changed. And then, of course, people who had psychiatric conditions before the pandemic, much of this was made worse during the pandemic with the inability to deal with stress in the ways that they did before, and then lack of access to care, not being able to get to the pharmacy, the lab, to relatives the way that they had before. And, as people were talking about homelessness and so forth, obviously, people who don't have housing, people who don't have computers and Wi-Fi are even more affected. So I'd like to talk about some of the takeaways from my session, but also thank people from the other sessions, because so much of this weaved together. From Stephen Murphy Shigematsu, I think his talk on self-care and the importance of that was very important, and had a lot of takeaways. Dr. Christine Moutier from the American Foundation for Suicide Prevention had takeaways on both the crisis, the threats in COVID and suicide prevention, and that suicide is not an inevitable outcome, and that some of the silver linings are that we've been able to talk more about mental health. So the unanswered question, are there going to be more people? Some of that is, of course, the bad news of the the after effects of COVID. Some of that might be from normalizing discussion of mental health. And Dr. Moutier has lots of good examples about, you know, everybody from Meghan and Harry talking about mental health issues, and just this idea that it's okay to not be okay, that that mental health is an important part of physical health, that you cannot have health without mental health. And so there may be more treatment seeking. Telehealth may make it more accessible for some people, not for everyone. And then takeaways from Dr. Shashank Joshi's talk. This is a pretty unprecedented time in terms of how COVID-19 has affected children and adolescents and schooling, and then the way that that's affected everyone in the family. It's caused the largest disruption of education in history. So by mid-April 2020, 94% of learners worldwide were affected by the pandemic. So this is something that the Spanish flu, that was big. This is big on a different scale. And then I'm going to include Washington Post reporter Marian Liu and Helen Sue's talks as some related takeaways, that there was this double pandemic for Asians in the United States because of both rise in anti-Asian violence and discrimination, that I think Marian Liu was one of the first people to spot this. I remember her contacting me at the beginning of the pandemic, and I said, I don't think I've seen anything. And then boom, more and more. So, and Dr. Su, as you know, as a clinical psychologist at Stanford, is dealing with both of these pandemics at the same time and how they affect students and people in the Stanford community. So those are some of the problems that were highlighted, some of the takeaways, but then some of the opportunities are this ability to reach out to one another, to, you know, so with anti-Asian violence, to reach out to other communities and allies, and then how that really dovetails with some of the disparities. Dr. Rakoff, you had Dr. Lisa Fortuna in your session, and she's been doing so much for, you know, reaching across communities. And so that, you know, when there's stress, we can fight or flight or flock. So I think fighting is sometimes the right response. Flight, I'm not, you know, we're not going to flee, right? We're going to confront this, and flocking is really the way to go. Oh, and I wanted to do a shout out to Dr. Kim. I did not know you were in Kuala Lumpur because you were at the Asian Staff Forum thing, which must have been, you know, 3 o'clock in the morning your time. So, and then Dr. Cody for saving so many lives by putting putting us on lockdown, even when everybody was like mad about it. It was the right thing to do. Oh, I need to do a shout out to my brother, Dr. Dale, who is, you know, who's been working with Dr. Fauci and vaccines and so forth. And then a special shout out as well to Dr. Upi Singh for saving our 90-year-old father when he had COVID and got the monoclonal antibodies. It means a lot to me to be able to see your face and thank you directly. And of course, thank you to all of the people from Stanford Care. Actually, one of the things that came up both in Dr. Murphy Shigematsu's talk and in Dr. Shashank Joshi's talk is about gratitude, and that this is one of the things that we can learn from and benefit from each other. So thank you so much to the Stanford Care community and to all the participants, and also to the audience for joining us today.
Thank you, Dr. Hu. And thank you all for moderating your session so beautifully, and everything stayed on time, which is also nothing short of a miracle, I think, when we're bringing so many people together. So I am going to make some closing remarks now. I want to thank everyone for attending our second international COVID conference. We have a slide of everyone in their sessions. And so you can see all the sessions and all the moderators that were there and the rich discussion that ensued. I want to thank my co-founder of the Center for Asian Health Research and Education, Dr. Bryant Lin, for bringing this conference to life last year. We've come a long way in our global pandemic efforts, as we saw today, and I could not have been more proud of our progress from the last COVID-19 conference. Today, we had over 40 speakers and 500 attendees from all over the world across 12 time zones. Thanks to each and every one of you. This would not have been possible without you. Taking time out of your busy lives, many in the middle of the night in your time zone, thank you for joining us to learn and connect with great minds around the world. Special thanks, especially to our colleagues from India who joined us and shared their insights late into their evening and their early morning hours, despite enduring a COVID surge of immense proportions. The overarching theme of our conference was sharing lessons learned from tackling the COVID pandemic this year. In the public health session, we had reflections from Peru, Rwanda, Japan, and India about adapting to COVID-19. We learned that situational awareness, testing, data synthesis, infrastructure, proactive planning, community trust, and integration were all steps that are essential in implementing an effective pandemic response. Last year, we emphasized the importance of sharing information across borders for global health. And this year, we successfully shared our international expertise across disciplines and continents. I'd like to thank Dr. Garcia, Dr. Benagwahu, Dr. Jindai, Dr. Babu, and Chris Laboa for your words, and Dr. Sarah Cody for excellently moderating this session. In our data session, we learned how the integration of past data and current real-time data have been crucial for identifying community risk and establishing public policy priorities. Navigating clinical and non-clinical dynamics, using demographic data to identify risk differences, and making data universally accessible allows us to design simple yet comprehensive data models, engage our communities effectively, and advance safer public health initiatives. The comprehensive and continuously updated data collection, analysis, and modeling we observe today continue to educate our communities and workforces and offer promising algorithms that will keep us a step ahead of this pandemic. I'd like to thank Tim Souther, Debbie Lai, John Church, and Dr. Pajot for your work, and Dr. Shaw for moderating this session. In the clinical care session, we grasped the magnitude of the pandemic through the various COVID-19 waves seen across the world this past year. There is no one that has been unaffected by this pandemic. We learned how to make the most of our resources to adapt to the ever-evolving nature of the pandemic, and reflected on novel approaches to not only properly care for patients while preserving hospital resources, but also gather information to improve the safety of patients and the community moving forward. We navigated challenges in conducting and accelerating clinical studies, learned how to manage surge planning, and discussed next steps towards crossing the finish line in achieving global immunity and protection to this virus. I'd like to thank Dr. Artandi, Dr. Miyakawa, Dr. Butnagar, and Dr. Strelo for your work, and Dr. Gloria Kim for expertly moderating. In the health disparity section, we learned that COVID goes beyond its clinical impacts by increasing the visibility of racial, socioeconomic, and aging health disparities within our communities. We discussed the relationship between trauma and community trust, barriers in telemedicine accessibility, and the impacts and implications of this pandemic on Latinx, African American, Native American, specific Asian, and other vulnerable populations. In order to deliver precision medicine, We must continue to strengthen our collaborative research efforts to address the long-term impacts of COVID to vulnerable and minority populations, and especially to build trust going forward so we can address future health crises. Thank you, Dr. Vora, Dr. Fortuna, Dr. Carnathan, Dr. Mao, and Dr. Rios for your insights, and Dr. Rakoff for moderating. In our vaccine session, we reflected on the development of the mRNA COVID vaccines, from early genome sequencing in January to the distribution of vaccines in record time. We reflected on recent accomplishments and anticipate new variants and new challenges that we must focus our collaborations on in this next year. The key message is to take a COVID vaccine when it is available to you. The safety and efficacy of the currently available vaccines are unprecedented in medicine. We can all do our part to dispel myths and encourage everyone that we influence to take the vaccine as soon as possible. I'd like to thank Dr. Hu, Dr. Zhang, Dr. Misra, and Dr. Subramanian for your speaking today, and Dr. Singh for moderating this excellent session. And lastly, in our mental health session, we highlight the social and emotional burden this pandemic has dealt this past year. As we have rightly discussed socioeconomic and clinical impacts of COVID, it is equally important that we remain aware of the racial hate and harassment to address individual traumas and improve community resilience. In the words of Dr. Rona Hu, instead of fight or flight, we need to flock. In this next year, we must use our own and others' lived experiences to find the specific and culturally appropriate answers for being proper allies for our communities. I'd like to thank Dr. Murphy Shigematsu, Dr. Mutier, Dr. Joshi, Dr. Liu, Dr. Su, and Dr. Joshi for leading this conversation, and Dr. Hu for moderating. Thank you to Stanford School of Medicine Senior Associate Dean Michelle Berry and my fellow CARE co-founder Bryant Lin for opening our conference this morning, Dean Lloyd Miner and Dr. Lakhani for providing our keynote addresses, and our summary panel of interdisciplinary faculty for sharing perspectives and insights to close our conference today. I want to especially thank and recognize all of the staff who worked tirelessly behind the scenes to organize this conference with over 40 international speakers flawlessly. Thanks to Clark Sedninger, who spotlighted and mic'd the speakers today. Thanks to Jed Obra, who's joining us in CARE for his gap year, who did a wonderful job summarizing our sessions today and will be leading the manuscript synthesizing these important lessons learned internationally. I want to especially recognize Chloe Salas, who's on her way to medical school next month after having worked with us at CARE for her gap year, and Nina Lee, our new CARE program manager, who joined only weeks ago. We are so grateful to their attention to detail in designing the website, the program, inviting all the speakers, compiling together, and remotely advancing every single slide that you saw today. We have already received wonderful feedback from attendees and speakers who felt very well supported, thanks to the hard work of Nina Lee and Chloe Salas. Thank you very much. The recordings of today's conference will be available on the CARE website and the CARE YouTube channel. Please look out for them and share with your friends and colleagues. Many, many thanks to the Center for Population Health Sciences, Center for Digital Health, and Center for Innovation and Global Health at Stanford for co-sponsoring our conference today. Thank you for continuing these international conversations that will last through generations of clinicians and scientists. Though many of us are starting to see the light at the end of the tunnel with continued vaccine rollouts and social distancing, it is important to recognize that we still have a long way to go to vanquish the pandemic and holistically advance our global health. Life will not be better for anyone unless it is better for everyone. I continue to be humbled by all the great minds around the world who continue to work around the clock to address the COVID pandemic. I am heartened and confident and energized that with this brain power and continued international collaboration, we will be able to architect innovative solutions for the future. We have learned today how we can take advantage of our strengths and identify our weaknesses to work together in predicting and preventing the spread of COVID-19, while proactively laying the foundation to conquer any health emergencies that we may face in the future. Thank you for joining us. We hope that in the near future, we will be able to warmly welcome you to the Stanford campus for an in-person conference. Until then, we wish you and your loved ones the best during these turbulent times. Hope you all stay healthy and happy, and we look forward to seeing you next time.